My name is Professor Gachutha, a counseling psychologist by training, and I've been working for more than 20 years. And I am the director of Kenya Institute of Business and Counseling Studies, a TVET institution, offering counseling courses and other courses, and also offering counseling services to people who require support. I am also the chair of Community Anti-Drugs Coalitions of Kenya, setting up coalitions within communities to fight against drug abuse. It is a preventive approach that we use in order to take care of our children and the youth so that they don't initiate drugs or even they don't develop dependency. Now, mental health is a big problem in Kenya, and we are ranked number 5 in the countries that were assessed or that were evaluated in the year 2017 in Africa. And among 10 people, 1 person in Kenya is said to have a mental health condition. So you can see it is big what we are dealing with. Issues of mental health have to do with how a person is emotionally and even in terms of the thought processes and the way they socialize with other people and the way they carry out activities around them. And if they have a mental health issue, that means that they are not going to be able to deal with stresses or stressors within an environment or within the workplace or even within a relationship, because their ability to handle their thinking, their feeling has been diminished. And therefore mental health is all-rounded. It is social, it's spiritual, it's physical, it's emotional, it's cognitive. We look at all those aspects and how a person is functioning in terms of those aspects. And if they are limited, then we say this person is challenged mentally. We have various mental health conditions or disorders that people present with or they manifest with, like depression. And in Kenya, we rate very high when it comes to depression, or it is most prevalent. Whether we are talking about maniac depression, or we are talking about when a person is simply feeling depressed and is not able to eat or not drink or not undertake the activities that they usually do. That is the time that we say that the central nervous system in the brain have been depressed and the person is not able to pick themselves up so that they can do their activities. But again, depression comes in a maniac way, That time a person is energetic, is aggressive, is doing things, and then the energy goes and they go down again. That we call bipolar, because you're having two. There are times you're down and there are times you are up. But there are people who have endogenous depression. Endogenous is when you're flat, the same way, year in and year out. And people say you're okay, and other times you're not okay, but they can see this person has been like this all the years that I have known this person. That is the description that people within the family or in the neighborhood or in the community will describe this individual. But again, we have the smiling depression or the masked depression. You are smiling, but when you stay with this person, you can see they're not well. They're not picking up the way they used to pick up. They're not doing the things they used to do. They have no interest in relationship. They have no interest in activities, but they are smiling. Like they would want to give a communication, I am okay. But that's a mask. They are not okay. You can tell they are not okay. But again, we talk about schizophrenia, or when one is psychotic, And those are the people that traditionally we know they are not okay, because they are correcting people along the road, or they are removing their clothes, or they are beating other people. Then that person, we say they are psychotic, or they are maniac, or they are schizophrenic. So that's a condition where a person is having a lot of energy to do, and they are very actionary. But again, a person may have no feelings completely. And you're looking at a person and they're just there. And members of the family will say, our so-and-so is just there. Meaning, they're not emitting life. They're not emitting something that they can relate with. This is a person that we knew before. So those are some of the most prevalent and common mental conditions that we treat as psychologists, as counselors, and even the psychiatrists will deal with that. But the other one that is common is anxiety disorder. In Kenya, we are having a lot of anxiety disorders, and I think it's because of the trauma unresolved, a lot of post-stress disorders that people are presenting with. And because of that, they are panicky about situations they are in, because maybe the trauma happened in a situation, or they are panicky because of people, they are uncomfortable in the midst of crowds or in the midst of friends. And maybe whatever happened that is traumatic for them happened within friends, maybe a date rape or something, and therefore the fright and the scare that one has when it comes to crowds, or when you're carrying out an activity, because maybe the demand and the control and the authoritarianism of the parents that you must do, you must perform, and therefore you get scared when it comes to performing things. And so the person is pulling away instead of pulling towards, they pull away, because it's like, I can't make it, I can't handle it, I am panicking, I don't know how to hold myself, I'm panting, all that. And yes, when it comes to anxiety, a person may be presenting with a depression and anxiety too, and panic disorder too. That means that you're now dealing with comorbidities. You're dealing with more than one condition when you're dealing with this particular person, and then you have to make sure that you take care of each one of the conditions that is getting presented. Otherwise, the condition is going to get worse if you do not acknowledge that you're dealing with multiple conditions in this particular individual that you are treating or dealing with. These conditions come very slow, within a process, and it's like you're not realizing that it is coming until the symptoms now become too much, and now you realize I'm different. Like, for example, if a person is depressed, the hopelessness will come slow and sure. The not believing in oneself, the things that happened, like maybe at home being shouted at, being named, but now you're telling yourself, I am a waste of space. And so you realize, why do I say that? I'm not important. I'm ugly. I am a disappointment to my family. I am not good enough, even to my workmate, even in the position that I hold within my workplace. When now it starts dawning in the statements that one makes, that's when one realizes, by the way, who have I become? But it can take a long time for one to get to a place where you are aware of yourself. Not that people are not very aware of themselves in terms of what they think and what they feel that is positive or negative, because they are not recording. It is something that happens at a very unconscious level. Until now, it has gotten you to a place where you're not functional in certain situations or in things that you're supposed to be doing. And so you start getting worried that I have changed completely. I'm not the person that I used to be before. So I would say that it comes vicariously within a process, and it is when now it has become, it has gone beyond when one is realizing I'm not myself anymore. It has a lot of impact, say like one as a person, you start realizing that you're not the person you used to be before. You're thinking negative free. You are feeling very negative. You're always sad. You're crying. You're withdrawing from people. You're hopeless. You're helpless. You're not eating well. You have no interest in varied activities. Then you realize as a person, you're not the person you used to be before. When it comes to career, you realize you're not productive, you're always being shouted at, you're not connecting with your colleagues, you're not getting promoted, your appraisal is negative. You know, all these things are crowding on you to tell you, when it comes to career, you're not performing very well. And even when it comes like to health, your own health, you can see the deterioration of your health over time, that it is not just being negative, but now you're getting to a point that you are crying all the time. Now it's getting clinical, it's getting chronic. So it's not where you were last year. You are in a different space now in terms of the progression of the disease. Because we talk about the progression of the disease, it's getting worse and worse and worse with time, and you're in a bad place the more you do not attend to it. I have personally worked with people who are in creative arts, whether they are in music industry or laugh industry, or they are in performing arts, like the Tasker Project film, where we supported as an institution the contestants. And one of the things that we were realizing is that they work under pressure. There is always the pressure to perform, and the people around them always want them to be in a certain way. So there are a lot of shoots and masks and odds around them, to a point that you may lose yourself. You may lose a connection with yourself because you want to connect with what people say about you and the evaluation that they are giving you. And sometimes the evaluation is very negative. You don't know what to do about that. Again, when it comes to their lifestyles, they must be smart. They must drive a certain kind of a vehicle and stay in certain places within town, not in certain places. And so the demand about their lifestyles is big time. You have to accept yourself and say, you know what, I am not going to be pressurized to behave in a certain way so that I can fulfill certain standards that people have set for us in the creative industry. No, I don't want to do that. So there is a sense in which they can even have multiple personalities. Multiple personalities in the sense that there is the personality for the stage and for the public, and there is a personality that is private for you, and many others in between. When you become like that and you become segmented, you now start becoming a candidate for mental health. Because you see, you are disconnected with yourself in some of the personalities so that you can be able to give the public the kind of a person that they require at certain moments. So that pressure, and also most of them are sanguines. For you to entertain people and to feel good when you're entertaining people and you have the energy for people, then you must have a lot of energy for that. And most of the sanguines, they don't have a very good connection with themselves. And therefore, because of that, they are going to easily develop mental health conditions. Just like safari rally vehicles that require synthetic oils for them to be able to do the aggressive runs, that is the same way that someone in the creative industry needs to be like in terms of your own self-care. your own lubrication of yourself, your own oiling of yourself, your own integration with yourself, connection with yourself, that you have to have a very good self-care program that you have with yourself, so that all the time you're oiling, you're lubricating, you are adjusting, you're modifying, so that all the time you feel you have a good connection with yourself and you're well refreshed, even when you're doing a lot of activities and you're required to attain certain levels of performance, that you can tell yourself, if I have not performed the way I needed to perform, it is okay. There will come another day when I can be able to perform in a better way. Just allowing themselves to be human beings and to have a healthcare, self-care program or regime that they keep to themselves is very ideal. Just the same way with the politicians, because they're in the same category when it comes to the expectations of the people to them. There is the curative and the preventive. And I would recommend the preventive before you go now to the curative, because the curative now is medicine and psychotherapy, and you don't need to get there, where you are now clinical and you need now psychotherapy to help you to be able to come into terms with yourself and also take medication. You can be attending therapies for preventive. You can be having mentors to walk the journey with you. You can be having coaches to help you to be able to deal with yourself and regulate yourself properly, so that at all times you are abreast to yourself and you're not getting yourself to a point where you're drained completely and you're burnt out completely and you don't have energies for yourself, whether they are cognitive energies or spiritual or physical energies or relational energies, all these types of energies that we require for us to be well refreshed. So I would say that a regime of having therapists, even if it's one session per month, check out yourself with a mental health worker, so that you can know where you are at and you can be able to go for a long time and improve in your career, because you're taking care of yourself. So I would say counseling services is a must do for people in the love industry and performing arts. There is a solution, and that solution lies within our government, lies within families, lies in the institutions and also in the individuals. And we understand why I'm talking about institutions and government, because there are policies that need to be implemented consistently, like counseling and psychology. Counselors and Psychologists Act has never been implemented from 2014. What is the government doing? What is the Ministry of Health doing? Don't we realize that we need the Counselors and Psychologists Act so that it can inform on how the counselors and psychologists are supposed to be performing their work? How do we work in a vacuum of legislation? So I would say the government needs to do its work, institutions need to do their work, like the Ministry of Health, and families need to do their work. If we bring up our children as parents in ways that help children to be able to attain life skills, and even for schools, teach children life skills to be able to deal with stressful situations and to increase their capacity to be able to handle the vagaries of life, then people will be able to handle situations very well. If also people are more responsible, like see how politicians are irresponsible during this season. It is all about them. We the public are supposed to recruit them because we are the employers. We are supposed to employ them, but we employ them by force. and they need us to be toxic because they are throwing their toxicity, their poisonousness because of the words they are uttering, and even the way they are mixing us up. If they have issues with themselves between their camps, can they sort that out for themselves, but not bring it to the public gallery? What are we supposed to do with that? What are we supposed to do with their hatred of each other? What are we supposed to do with their anger, with their resentment? They need to go for therapy themselves so that we can have an environment that is clean for us. But our environment is very dirty. So if we cleaned our environment, whether it is at home, what parents do, what couples do with each other, then that environment is going to be healthy for children. And if politicians and people within institutions can do their work, then our environment is going to be good for us. We can stay in harmony without having anxieties and panics and depressions and schizophrenia. We are not going to have them because we are taking care of each other and we are healthy as we coexist with each other. I would say it's okay to be unhealthy, so that you don't feel ashamed of yourself when you are having a mental health issue, because then acceptance of that helps you to do something about your situation. And society should stop stigmatizing people who are struggling with mental health conditions. And it is important for institutions and whether they are faith institutions, to educate people on mental health so that people can be able to respond appropriately to people who are struggling with mental health conditions. And for the ones that are struggling, accept that you're going through a struggle so that a solution can be found for you.